Cancer will affect 1 out of every 8 American women. From Melissa Wheatley of Hampton, the diagnosis came at 53.
And it left the mother and grandmother searching for a way forward. The Fox Medical Team's Beth Galvin is here now with her story. Beth.
And Marissa and Tom, Wheatley was diagnosed with triple-negative breast cancer, and it was advanced. So she was told she could go with the standard treatment, which for her would be chemotherapy, which may or may not work, or she could join a clinical trial and try an experimental treatment. Wheatley says the choice for her was easy.
So far, my blood work's been great.
Melissa Wheatley is now a familiar face here at Piedmont Fayette Hospital's Cancer Center. The Hampton 53-year-old's been coming here since she found a lump in her breast back in October.
I just had this feeling that it was cancer.
And scans showed Wheatley had not just 1, but 2 masses in her breast and more cancer in her lymph nodes and lungs and bones. On Halloween,
We got the news that it was stage 4.
That's when Wheatley came to see Piedmont Fayette oncologist Trevor Feinstein, who explained she has triple-negative breast cancer. Dr. Feinstein says only about 10 to 20% of breast cancers are triple-negative, but this type of cancer is more likely to spread beyond the breast, more aggressive, and harder to stop.
It's a very bad disease. You know, when it has left the breast and traveled to distant organs, the median survival is less than a year.
With chemotherapy,
I was looking at maybe a 20% to survival.
so Wheatley joined an early-stage clinical trial here at Piedmont Fayette, testing a combination of 2 cancer immunotherapy drugs. One is pembrolizumab, or Keytruda, already FDA approved to treat advanced lung, skin, head, and neck cancers. The other is a still experimental immunotherapy drug known as SGN-LIV1A. And used together, researchers think that they might help a patient's immune system better find and destroy cancer cells. So Wheatley wanted in. This is treatment number 6, and she's had some expected side effects.
I lost my hair, bam, first treatment.
Yet something unexpected seems to be happening. This is an early stage study to find the right dose of medication, not how effective these drugs are. But here's the thing. Wheatley's cancer seems to be disappearing.
After the first 2 treatments, I had a scan, and all the masses in both my lungs were gone.
Her most recent scans, we couldn't identify her cancer.
Dr. Feinstein is hopeful but cautious.
Yes, you can't see the cancer, but there's still a fear that there's microscopic cells there. We will keep this going. We're going to keep a close eye, keep monitoring her about every 6 weeks, and see what the future holds.
Still, Melissa Wheatley is grateful they're talking about the future, her future.
It's a miracle. It's a miracle.
And Wheatley lives with her mother and her 4 grandchildren, so she's really grateful that she didn't have to travel far from Hampton to be able to take part in this study in Fayetteville. And for now, her scans are clear, and she says, Tom and Marissa, that she's just going to keep pushing on. I mean, that's what you do.
And it's so good she followed her intuition when she said, I have a feeling.
Absolutely.
It's this, and she saw about it.
So much to be hopeful for.
Yeah.
Thank you, Beth.